Imagine you are 60 years old. You smoke. You are overweight. You have a history of high blood pressure. One morning you wake up with crushing chest pain, nausea, shortness of breath. Your left arm feels strange. You don't want to bother your doctor. There's an app for this now. The government endorsed it. The health minister called it revolutionary. You open it. You describe your symptoms. The AI tells you, panic attack. Take it easy. No need to rush to hospital. This is not fiction. This is not a worst-case scenario someone invented to make a point. This is a documented case from a real AI health app. An app that was valued at $4.2 billion. An app that 2.8 million people in Rwanda depended on for their primary healthcare. An app that the UK's National Health Service paid over £22 million to deploy. And when a doctor, a real oncologist, tried to warn the world, the company pulled his private medical records and used them to attack him publicly. Uncle K Media presents The Unicorn Graveyard, Episode 3, Babylon Health, the AI that couldn't spot a heart attack.
Babylon aimed to transform the healthcare industry using cutting-edge artificial intelligence and telemedicine.
Babylon's mission is to put an accessible, affordable healthcare into the hands of every human being on Earth.
I think it is time for making a massive change of bringing healthcare to the 21st century.
Put most of the healthcare most people need in the world and deliver it to them on the mobile devices they already have.
But it's actually dangerous because it's giving out false information. It's not helping people.
So think of it as an artificial intelligent doctor that is sitting in your pocket all the time, observing what you do if you give it permission to do so, and then intervening when necessary.
Babylon is a private healthcare juggernaut striking deals with the NHS, and it's linked to those at the top of government.
Meet Ali Parsa, born in Iran, fled the revolution at 16 with nothing, taught himself English, earned a PhD in engineering at University College London, climbed the ranks of Credit Suisse, then Merrill Lynch, then Goldman Sachs, where he became executive director of European technology banking. This is not a man who stumbled into the startup world. This is a man who knew exactly how money moved and exactly how to make it move toward him. In 2004, Parsa founded Circle Health, the first private company ever to run a national health service hospital in the United Kingdom. It was bold, it was controversial, and when it ended with a scathing parliamentary report calling the cost savings unachievable and the oversight poor and inadequate, Parsa had already moved on. He founded Babylon Health in 2013, and this time the pitch was something that no investor, no politician, and no government could resist. The pitch was world-changing. The pitch was compassionate. The pitch was, as one former senior employee put it, something they genuinely believed. Inside the company, Parsa was described as a cult leader, but not in a bad way. People followed his vision with genuine devotion. The mission, affordable healthcare for everyone, was real. The technology was another matter entirely. The Royal College of Physicians, London. Ali Parsa takes the stage. The room is full of healthcare officials, investors, journalists. He makes an announcement that sends shockwaves through the medical establishment. The headlines write themselves. The investment rounds follow. Babylon's Series C, $550 million, becomes the largest digital health funding round in European history. Saudi Arabia's sovereign wealth fund leads the round. Kinnevik, VNV Global. The investors include Demis Hassabis, the founder of Google's DeepMind AI division. The UK Health Secretary Matt Hancock calls the NHS app service revolutionary. But there is something else that happened at the Royal College of Physicians demonstration that day. Something that was buried in footnotes and press releases and only surfaced years later. When Parsa showed the AI performing a live consultation, including a facial analysis of a patient detecting subtle emotional cues a doctor might miss, he said to the audience, "This is a real consultation. This is what we have built. None of this is a show. It was a show. The facial analysis tool was a prop, a demo that had never reached the product. The woman in the video was a Babylon executive assistant, the AI capability being displayed to an audience of investors and health officials did not exist in the product being deployed to NHS patients.
The artificial intelligence stack we built sits on what is today the largest knowledge base in primary care medicine, 530 million strings of knowledge.
Well, our AI is safe. And the reason I say this is that we've had our AI assessed 10 times by NHS bodies over the last years.
So,
Hi, Ali. Looking at your calendar and emails, I see you've been really busy recently. How can I help today?
we can deliver most of the healthcare most people need on the devices most of them already have. That's highly accessible.
Let's talk about what the AI actually was. Babylon's core product was a symptom checker chatbot. You described your symptoms. The AI analyzed them and told you what was wrong, whether you needed to see a doctor, and how urgently. That is an enormous amount of responsibility to place in any system. A missed diagnosis is not a bug, it is a patient at risk. So what was inside the technology?
As I say, these chatbots are currently regulated to the same level as a walking stick or a pair of spectacles.
In 2019, the Times newspaper in the UK reported a documented case. A 60-year-old female smoker, sudden onset chest pain, nausea, classic symptoms of a heart attack, textbook presentation that any first-year medical student would recognize. Babylon's AI diagnosed her with a panic attack. The same AI, tested by independent critics, also diagnosed an ingrown toenail as gout. It failed to flag symptoms of blood clots. It told users experiencing severe symptoms that they were fine. An NHS oncologist named Dr. David Watkins had been warning about this for years. He had been publishing the evidence, raising the alarm, asking Babylon to provide independent clinical validation of their claims.
But Dr. Watkins says this provides little reassurance.
The CE marking from the perspective of chatbots is meaningless. It gives false reassurance.
Several senior doctors Newsnight has spoken to agree with Dr. Watkins. They say, given the symptoms listed, heart problems, including heart attack, are far more likely than sickle cell disease.
Babylon's response? Dr. Watkins later said, Babylon knowingly released a dangerously flawed medical device and put the public at risk of harm. Babylon made false claims with regard to the capability of their AI technology, and when challenged regarding safety concerns, Babylon lied. That word, lied, was chosen deliberately by a senior NHS oncologist, not overstated, not exaggerated, not got wrong, lied. Here is where the story becomes something different from a simple startup failure. Between 2015 and 2022, Babylon had 22 meetings with UK government ministers. Matt Hancock, the health secretary who called Babylon revolutionary, had his 2019 Conservative leadership campaign receive £10,000 from individuals connected to Babylon. Dominic Cummings, Boris Johnson's most powerful political advisor, the architect of Brexit, was a paid consultant to Babylon. His role ended months before Hancock's public endorsement. He never disclosed it. Babylon Health raised $1.2 billion. It was valued at $4.2 billion. It was sold for £500,000. Investor returns, approximately zero. The number isn't the valuation, it isn't the money lost, it's the silence of 2.8 million people who trusted a machine to keep them alive. And the question is no longer if AI will replace doctors, it's who pays the price when it's wrong. If you want the truth behind billion-dollar failures like this, subscribe to Uncle K Media, because the next story might be happening right now.